Good morning. Could I get everybody please to get seated? We're going to go ahead and get started with today's program. I know there's a line outside in the parking garage, so people will be trickling in as we get started. My name is Dr. Rola El-Serag, and I am the director of the Center for Health and Biosciences at Rice University's Baker's Institute for Public Policy. It is with great pleasure that I welcome you to today's event, Preventing a Firearm Injury in the Greater Houston Area Through Purpose and Policy. The Center for Health and Biosciences is committed to producing rigorous scientific research in relevant public health areas and translating this research into meaningful action as community outreach and interventions and effective policy and legislation with the ultimate goal of safeguarding and improving the lives of people in our communities. Today, we intend to do just that with what has become, unfortunately, one of the most critical public health crises in our nation: firearm-related injuries and death. My first major initiative as the new director of the CHB was to establish a program dedicated to firearm injury prevention and safety by recruiting two experts in the field as senior fellows, Drs. Bindi Nayak and Sandra McKay, who will be leading our event today. And I thank them very much, as well as Caitlin May and Jackie Klotz, for their vision and hard work in planning today's event. I would like to take a few moments to discuss why it is so important that we have a section of the CHB devoted to firearm injury prevention and safety. Across the country, firearm-related injuries and deaths have been rising at an alarming rate, especially among youth and young adults. The increasing number of adolescents experiencing mental health issues and the surge in homicides, unintentional shootings, and school-based violence are among the factors contributing to the record number of deaths. Firearm injury is the leading cause of death in children ages 1 through 19 since 2019. In 2020, more than 45,000 Americans were killed by firearms, a 15% increase from the year before. More than 115,000 people annually are injured by firearms in the U.S., and since approximately 40% of U.S. households contain firearms, we need to make firearms safer. Unfortunately, these deaths and injuries were both predictable and preventable. So where did we go wrong? As a nation, we have failed to address this tragedy systematically and effectively as a public health crisis. Political ideologies, misperceptions, and reactivity have failed to produce any meaningful legislation to make our communities safer from firearm injuries. Gun violence costs more than $220 billion annually in the United States, exceeding the health care costs of obesity. Despite this staggering figure, federal funding of research on gun violence and injury was frozen for 22 years, undermining critical research that should have been conducted to drive public policy effectively and meaningfully. Going forward, it is imperative that we focus on studying firearm injuries and deaths in its many forms and utilizing the results of such scientific data to guide public policy and community strategies. In essence, using a public health approach. Today, you will hear about the current state of firearm violence in the greater Houston area from our experts and our mayor, the Honorable Sylvester Turner. You will then hear scientific data and analyses on firearm injury and unintentional shootings, suicides, school-based violence, and interpersonal violence, followed by presentations of current community intervention efforts and their successes. Finally, after a review of the current Texas state policies regarding firearms, a panel discussion of policy experts will be held, including our HPD Chief of Police Troy Finner, Harris County Sheriff Ed Gonzalez, Texas State Representative Ann Johnson, Texas Senator John Whitmire, and Harris County District Attorney Kim Ogg, with the goal of defining future steps forward. This, we hope, will be the first of many relevant discussions and community partnerships focused on improving policy and interventions in the Houston area and Texas as a whole, where evidence-based research is translated into meaningful action and change. It is difficult to live in a world where parents send their children to school in fear and where gun violence is personal, having touched the lives of so many. In the wake of recent horrific tragedies such as Uvalde, today's discussion will likely be challenging, emotional, and hopefully eye-opening for all of us. But it is time to open the dialogue, however difficult it may be, in order to create a safer tomorrow. A few logistics. We will not be taking questions during the lectures or the talks. You all have question cards on your tables, so please go ahead and write your questions down, and they will be collected and be attended to. It gives me great pleasure to introduce our first speaker today, Dr. Bindi Nayak. Dr. Nayak is a pediatric trauma surgeon and associate professor of surgery and pediatrics at Baylor College of Medicine, who has experienced firsthand the tragedy of firearm death and injury in children. She developed and led the Level 1 pediatric trauma program at Texas Children's Hospital for over 10 years, and is an avid researcher in pediatric trauma, injury prevention, surgical outcomes, and health services. She holds an MD from Texas A&M University College of Medicine, an MPH from Johns Hopkins Bloomberg School of Public Health, and received advanced training from Baylor and Children's Hospital of Los Angeles. Please join me in welcoming Dr. Bindi Nayak. You want to go ahead and introduce him? Okay. I'm sorry.
Good morning. Thank you so much. Perfect timing. Just before we get started, we have been joined by the mayor. I believe I saw him somewhere. Mayor Turner. Thank you so much. We're so honored that the mayor could join us this morning. He will be saying a few words, and then I will continue with my presentation. Thank you.
Well, let me say good morning, and especially after an extended weekend, so it's good to be with each and every one of you. And look, I know you got a long agenda for today with a number of speakers, so let me kind of just dive right in. As I was thinking about my comments this morning, you know, the pandemic, COVID, has been and is a global pandemic. Global in nature, all countries involved. Gun violence, however, is an American problem. And it is an American public health problem, the way I look at it. But there is no other country outside of the United States that are facing the issues surrounding gun violence like the United States. This just happens to be uniquely American. I was listening to this morning on CBS News, getting ready. There have already been like 278 mass shootings this year. So more shootings per day than there are days in the United States. And it just things just keep happening. In fact, and if you just drill down to Houston itself, and prior to, in 2019 and before, in terms of homicides, Houston faced less than 300. In 2019, I think it was something like 278. And then in 2020, it jumped more than 350 plus. In 2021, it was 475. And where we are as of this morning, 219 homicides. Now, ironically, it is 1% less than where we were last year. So in almost every category of violent crime in the city of Houston, our numbers are starting to trend down when you compare where we were last year, which is good news. And then domestic violence in 2021 was up more than 40%. So there are a number of elements. I simply want to, we already know that we have a problem. Just wanted to highlight some of the magnitude of our problems. But the reality is there are a lot of guns in this country. There are a lot of guns. In fact, there are almost 393 million plus guns. There are more guns in this country than there are people in this country. The United States makes up 4% of the world's population, but over 50% of the guns are in our possession. And then even when you drill down to Texas, you know, I was in the legislature for some 27 years, and then the big focus, the big push was the concealed handgun. That came through. People had to get their license, their permits, and it required training. But in the last legislative session, Now we have permitless carry, House Bill 1927. No license, no permit, no training. And so instead of pulling back on the reins, in the state of Texas, it's just moving forward at an aggressive pace. And then, so you got, which helps to create even a greater market or a greater love affair with guns. And it just doesn't appear that even now, the Texas legislature on its own is going to address the situation. And then locally, in terms of what's exacerbating the problems, when you add on to more guns, legislature making it more attractive, easier for people to get guns. Oh, let me also add, they lowered the age for guns from 21 to 18. Okay, so it's harder to get cigarettes than it is to get a gun in the state of Texas. And then when you drill down in Harris County, for example, we have a huge criminal case backlog in Harris County, misdemeanor and felony cases, and I underscore felony cases. The backlog in Harris County is larger than the backlog of any county in the United States. And that's primarily for several reasons. When Hurricane Harvey came in 2017, it put a lot of our criminal courts out of commission. And quite frankly, many of those courts are not back online. When COVID came, no jury trials, so that created the backlog. So we have a huge criminal court backlog, cases ready to go. What that means is that there are people who have committed crimes who, their trials may be 2, 3, 4 years down the pike. And then when you add to the fact we don't have enough criminal courts, quite frankly, I think the state has only created one additional criminal court since the mid-'80s in Harris County. So we don't have enough criminal courts. And then we have too many people who are out on bail who are recommitting crimes. And then when you combine all of that to the fact that there are still too many people who are in crisis mode within our city. All of these elements, when you put it into the mix, makes it very difficult. What are the steps that we are taking locally? About 4 years ago, I established the Mayor's Commission on Gun Violence. Doctor here was a part of that. Came up with a number of recommendations. They did a lot of hard work. I give a lot of credit to Haley Carter, who was a part of that. But it also required the legislature to take some definitive steps. That has not occurred, so we just have to continue to work on that. And then in February of this year, I put forth an initiative, One Safe Houston, holistic in its approach, not just one element or two elements, but very holistic. And it calls for more police in terms of even bringing more police to our cadet classes as well as overtime. So it calls for more police. It calls for the use of more technology because we have about 5,200 police officers in the city of Houston. Very difficult to cover 640 square miles. And so it also requires for the use of greater technology, shot spotter, license plate readers, cameras as a part of the mix. It also called for a gun buyback initiative, which will take place in July of this year. And then it spends a great deal of resources on our crisis intervention. People who are suffering from mental behavioral health issues, people who are suffering from substance abuse. We are spending almost $30 million just on our crisis intervention. Recognizing the fact that the number of domestic abuse cases has gone up, we've put together a domestic abuse response team, DART, and put a lot of resources in there and working with many of the stakeholders in this field to try to get to these situations much, much sooner. We are investing in our reentry program. Every year, there are about 13,000 people released from the Texas Department of Criminal Justice coming back into Houston-Harris County. And so we're investing more money in reentry. They need jobs and they need housing. And what we have found is that our reentry program is much more effective than even the state's program. It's working, so we're investing more resources there. And then we're utilizing our community assets. So putting resources into our violent interrupters program, Credible Messengers program, our youth initiative. Quite frankly, the city's summer internship program is a part of that. When I came in as mayor almost 7 years ago, 450 positions for summer interns, paid summer interns. This year, the number is more than 14,000. Because what we also recognize is that population between 16 and 24 are driving many of our crimes. And so the jobs program, the summer internship program, is for people 16 to 24. And our that young population are responding. And I want to thank the business community for responding, because over 400 businesses in our city are responding. The city is only offering 450 summer paid interns, but the private sector is offering the other 13,500 plus. And so it's law enforcement, but it's also community, and it's also investing in communities that have been underserved. So it is a more holistic approach. And is it working? I will tell you that in January of this year, and I look at the numbers every single morning, in January of this year in terms of homicide, we were about 65% above where we were last year. As of this morning, we are 1% less than where we were. So we've gone from 65% down to 1, and in most of the categories, it's going down. So it is working. But let me quickly give a caveat. We're on the front line. The legislature does not allow us to restrict gun access or the venues. So we can't step into that space. Our hands are tied. The legislature needs to repeal House Bill 1927, permitless carry. It makes absolutely no sense. And it was said by all of law enforcement, the major police chiefs in the state of Texas, that if the legislature passed it, the crimes would go up. It took effect in September of last year, and the crimes did go up. So the legislature needs to act. And then there are a number of Texas big city mayors that met a week or two ago and decided, and Republican and Democrats, big city, decided that it was important for us to weigh in to the Texas legislature. So there's a letter that's already being prepared, in which mayors and big city mayors in Texas are saying to the legislature, number one, you need to be meeting right now. There needs to be a special session right now. Saying to them that you need to implement universal background checks. You need to increase the age from 18 to 21. Reverse what you did a year ago and increase the age from 18 to 21, or at a minimum put in place a waiting period. We are saying the red flag laws, that needs to be done. Those are things you can do right now, and most of these measures are supported even by most Texans. And then we are saying that you keep pointing in the direction of mental health. And quite frankly, every country has mental health issues. I just think that's a red herring. But nonetheless, if you keep pointing into mental health, then Texas needs to stop being in the bottom 10 in terms of mental health funding. So if you're saying it's mental health, then you need to, in a real way, fund mental health, fund community mental behavioral health initiative, if you say that is the cause. But you can't say it's the cause and not provide the funding and then expect things to change. So you can't have it both ways. And then lastly, what we are saying is that as elected officials, we are employees. The people like yourselves, you are the employers. We work for you. And in this country, we've kind of gotten things twisted. So if Americans are saying, if 90% are saying universal background checks is what is okay, if the majority of Americans said red flag laws, we need to do that. If Americans are saying we need to address mental health funding, But if we keep voting in different ways, then things are not going to change. The question then is, who works for whom? So Americans, voters, moms, dads, need to decide, how big is this issue? And whether or not saving the lives of our children is even more important than dealing with inflation. So which one is heavier? Okay? Which one is more important? Because no single elected official has lost his job on these issues. And as long as that happens, nothing changes. So elected officials have to do more. But quite frankly, the voters themselves have to vote consistent with their interests. So this is a very heavy topic, but it's not going to change unless we drive the change. I'm a person of faith. I offer my prayers and my condolences, but my faith also say that prayer without work is dead. So you have to do more. And Texas needs to do more. And we need to demand that our legislature do more. So it's very real. School will be going back, opening up again in the fall. And let me tell you, as I close, how the legislature works. The session will start in January of 2023. When people put forth committees, that's just what I call a cooling off period. Because when the session starts in January, the hope is the focus will be on other things, and that people will have changed and start focusing on other things, and then very few things change. There needs to really be a special session now before our kids return to school in the fall of this year. Anything less is putting our kids in harm's way, and that makes no sense. And so I'm hoping that moms and dads will speak for their kids. Because if you think, as one mother said, that you will not find yourself in the same situation as many moms and dads in Uvalde, then simply do nothing. But it is time for all of us to draw the line and say no more. So thank you for having me. Thanks for having this conference today. Quite timely, quite needed. But my hope is that after we go through these forums, that we will tell your employees, people like myself, to do their job or get fired. Thank you very much.
What a great way to start the morning. Thank you so much, Mayor Turner, for your words of wisdom. Okay, so thank you for the opportunity. I'm Bindi Naik Mathuria. As Rola said, I'm a pediatric surgeon. I'm also honored to recently join Baker Institute as a fellow to start this initiative in firearm safety, and we're very excited today to have this conference. The work I'm going to do today, present today, is funded by the CDC. And please note that a lot of the data that I'm presenting here today is preliminary, so specifically for the slides that say preliminary data, please don't share that, please don't quote that, please don't put it on social media, because it's not quite ready yet. We know this is a problem. I don't have to go through this again. Every day in America, a lot of people are killed by guns, compared to other developed countries, where 26 times worse. More than 40,000 Americans are killed per year. There's undeniable disparities. Black Americans are 10 times more likely to be killed by guns. Domestic violence is a real problem, especially for women. Firearm deaths and homicides are on the rise, both suicides and homicides. This report from the CDC was presented this year as a public health emergency, because look at the very sharp rise between 2019 and 2020. And children are also suffering from this. So in 2019, death by firearm became the #1 cause of death in children in the country, surpassing that from motor vehicle crashes. Just take a second to think about that if you didn't already know this. That's really, really significant and really, really sad as someone who spends my life taking care of children. There are many types of gun violence. Most of the attention is focused on fatal injuries, right? Homicides, suicides. All the data I showed you, all the data anyone quotes is talking about deaths. But what about those that don't die? There's a lot more non-fatal injuries than fatal injuries. As a trauma surgeon, I see, especially in children, a lot more children coming into the trauma centers and being shot and injured and maybe have significant disabilities or certainly psychological trauma. But that counts too, right? And so we're not even talking about that when we're talking about death, it being the #1 cause of death. The burden is even bigger than that. And there's very different types. It's a very complex problem. It's not as easy as saying, oh, let's just give bike helmets to everyone and stop, crashes from bikes. It is a multifaceted problem. There's different types of firearm violence. The assault homicide is by far the most common, by far, especially in major cities, especially in urban centers. This includes interpersonal violence. This includes domestic violence. This includes mass shootings. Mass shootings get a lot of attention, as they should. It's horrible, especially what happened recently. But it is a small proportion of the overall injuries and deaths from guns. The second major type, especially in children, is unintentional, or some people say accidental. We try to avoid the word accidental, and in the rest of this presentation, I won't be using that word. And the reason for that is because we're trying to make the point that it's not just an accident. This was due to negligent storage, and these weren't intentional. A lot of times the kids shoot themselves or shoot each other, and therefore they are considered unintentional. The other one is suicide, major problem, especially in adults, but rising in children and adolescents, also sometimes referred to as intentional self-harm. And then one that's not talked about much, but one that we focused on in our study, is the bystander shootings, or stray bullets, just being in the wrong place at the wrong time. As a trauma surgeon, I see a lot of these kids come in, especially in Houston. The bullets could just come through the walls of the homes, through the doors, or they're just standing at the bus stop. These are also a major problem. On the day I was preparing this presentation, I just pulled up the top stories in Houston. They're all regarding guns and deaths. I can't even turn on the news anymore because my 8-year-old is just, is already numb to this, sadly, but still, I don't turn on the news anymore because this is all they ever talk about. It's undeniable that Houston, we have a problem. But what can we do about it? Dr. Levine, my associate, is going to be presenting next, and he's going to go into this in more detail, but the murder rate in Houston has been rising for a while. It's definitely worse now, but it has been rising for a while. We've always had a problem. I've worked in trauma centers such as Ben Taub, and then in Los Angeles, and here, many of my colleagues who are trauma surgeons know this. We take care of a lot of people injured by guns. The problem is we only see one small side of it. There's a lot more to it. And so when we thought about how we can tackle this problem, we just wanted to know more. We wanted to know about the full spectrum. How many total firearm injuries are happening here in our county, both fatal and non-fatal? Where are these injuries happening? Who are they happening to? Why are they happening? And so using a public health approach to injury prevention, the public health framework is first to define the problem. Well, with this ban on firearm funding for the last 25 years, we're still at step one. We still need to define the problem. And so our work here today is focusing on the first two steps of this framework, which is defining the problem and trying to identify some risk and protective factors. And this is our program here. Basically, it's combining as much data as we can from as many sources as we can to try to get a full picture. And that's including all the data from all the level 1 trauma centers in Houston. That includes the non-fatal injuries, the fatal injuries, the shooting locations, shooting intent, and as many social correlates as we can find, including data on the shooter if we can find it. Definitely on the victims, where they come from, what they do, what their background was. And then combining that with medical examiner records, because a lot of the deaths that people that die at the scene, we never see at the trauma centers, and we're missing that data if we don't count them. So that's fatal injuries, it's residents in shooting locations. Shooting intent is a big one. We spent a lot of time really trying to figure out what the intent was and why it happened from the data that we have. And then combining police records of all crimes involving guns with or without injury or death, because if there was a gun there, then there could have been an injury or death, and that's still a risk factor. And also focusing on where these injuries are happening to try to identify hotspots. All of this is then analyzed, and part of the analysis is geospatial analysis using Census Bureau and Planning Agency in Houston. It's the Houston Galveston Area Council, which has a lot of really detailed neighborhood level information that can then give us neighborhood level risk factors and hotspots. And the goal of this is based around the injury prevention framework, the socio-ecological model, to try to identify individual, relationship, community, and societal factors that all lead to gun violence, each per different shooting intent, because they're also different. Okay, so what do we have so far? This is the data in adults. You can see that there's definitely been a rise between 2018 and 2019. There was a 50% increase. Note that non-fatal injuries were 2 times more common than fatal injuries in adults. So another way of putting that is that 1 in 3 adults who were shot died. In 2020, more than 2,000 adults were injured or killed by firearm in Harris County. So again, you heard the mayor say about 300 homicides. That is a number that's quoted a lot. But 2,000 were shot and got injured. So when you add in the non-fatal injuries, it's even bigger. It's an even bigger problem. Okay, and this is corroborated by the HFD data. So this is pre-hospital data from HFD showing that in 2020, there was a sharp spike in these shootings. Whether or not that's related to the pandemic, I'm not here to make any assumptions. I think it's a multifaceted problem. This is just the data showing that there has been a rise since around that time. And you can see some of the hot spots of the shooting locations in that picture there. When you compare the Harris County adult firearm death intent to national data, it's actually interesting. We have more homicides than suicides, and this has been consistent for the past few years. So in our time period, 2018 to 2020, about 59% of the deaths in adults were from homicide and 40% were from suicide. Unintentional is a very small problem in adults. Whereas nationally, 60% are from suicide and 36% are from homicide. We're still collecting data on the adults, so again, this is extremely preliminary, but we are working towards. I just wanted to show an example of the types of data that we're collecting, and that some of the conclusions that we might have. For instance, for suicides, we know that it's about 40% of firearm deaths. When you look at all the suicides in Harris County, about 60% were from guns. Median age is about 40s. Most commonly affects males, white non-Hispanic ethnicity. They usually occurred at home using home firearms, and they were more common in suburban areas, and there was mental illness about 50% of the time. Again, preliminary data. This is still work in progress, but we have collected a lot of the pediatric data, and so I'm going to go into a little bit more detail on that. So the pediatric data in Harris County, and the pediatric means under 18, of 0 to 17 is how we defined it for this study. First of all, it's clear that there's a huge increase. Look, between 2018 and 2020, 76% increase. Remember, this is fatal and non-fatal injuries. That's a lot, right? You can see the breakdown there on the injury types. I'll go into that in a little bit more detail. In 2020, more than 200 children and adolescents were injured or killed by firearm in Harris County. It's a lot. Too many. How are they injured, or why? That's what we're trying to figure out. So 54% of them were by assault. Unintentional was 19%. That's really high. I don't know if you follow any of these numbers, but if you look at the national data on unintentional shootings, it's talking about homicides. It's usually about 4% or 5%. So some people may make the argument, oh, okay, fine, it's just such a small problem. Why are we focusing on safe storage so much when there's so many bigger fish to tackle? Well, it turns out if you combine fatal and non-fatal injuries, it actually is a really big problem in children. Almost 20% of children could have been prevented from being shot. And then on top of that, there's a suicide, which they usually, happens from guns finding at home. It's low. It's actually 6% in our data here. I think that is rising, but this is the data that we have for those 3 years. Bystander shootings, which we very carefully separated from assault because they have different risk factors, are about 10%. And then in 10%, we just couldn't figure out why they got shot. 1% of cases were from Russian roulette, which is, we didn't know whether to classify that as intentional or unintentional because it's Russian roulette. But sadly, that also happened here. So in children, non-fatal injuries were 3 times more common than fatal injuries. Another way of putting that is that 1 in 4 children who were shot died. And when you look at the breakdown, these icons are representative of the proportions. So you can see that Black children were by far most affected. 15 to 17-year-old age group were by far more affected. But then look at the others. Hispanic was not far behind, Asian or other races, and then white was least commonly affected. And then the 0 to 5, 6 to 11 age groups were low, but still significant. I mean, these children should not be getting shot, and they were. 84% were male. However, the shooting intent breakdown was interesting. So whereas assault and unintentional injuries were similar, the bystander shootings were certainly more in females, just wrong place at wrong time. And then the suicides were certainly higher in the females, proportionally to males. 13% of the females that were injured or killed by guns was because of suicide. So breaking it down a little bit more by age, certainly the 15 to 17-year-old age group is the most affected, but you could see that the unintentional shootings, those marked by orange there, were really high, were much higher in proportion in the younger age group. You can see that suicides marked by the gray boxes there started around the middle school age. That bystander shootings were across all races, and unintentional shootings were also across all races. When you break it down by race, these are crude rates that are shown here. You can see that in proportion to in proportion to the population of Black children below 18 in Harris County, they were significantly affected by assault, as with the Hispanic population, but that suicides was highest in the white cohort. But the odds of dying by suicide was about 3 times higher in white children than Black children. And then unintentional shootings were common in all 4, or not common, but the kind of similar prevalence in all 4 race groups. What about the injuries? So these are the injuries that we saw at the trauma centers. You could see that about a third of them were superficial, so those are the non-fatal ones, but there's certainly some serious ones. 27% of them required ICU, 58% of them were serious enough to require operation. But when you think about the non-fatal ones, the 24% of them had residual symptoms after 3 months. So maybe they couldn't walk, or they had a lot of pain, or they had a lot of issues. And we're not even measuring the psychological impact because there's not a good measure for it. I assure you it's more than 24%. And then 12% of the children that come to the trauma centers, that made it to the trauma centers with firearm injuries, died. Vast majority from brain injury. Those are the ones that can't be saved. We have excellent trauma centers here in Houston, and because they're so centrally located, the survival when people are brought to trauma centers with gunshot injuries is high. So that doesn't mean that they weren't serious. They could still be serious if they survive. This is one of my favorite patients, and the reason that I really got inspired to do this. This is a little boy who was shot just sitting in his home, and a bullet came through the door. And he survived, but he was in the hospital for a really, really long time. He went through so much pain. It was so hard watching him, watching his family. They were completely destroyed. He could barely walk. He had so many problems. He's doing fine now, thank God. But it took a really long time, and I don't think he's never going to recover from that. He's never going to have a normal life. And so this is why I want you to, again, making the point that non-fatal injuries from guns are just as bad. And we need to include them when talking about gun violence. So we look for some social correlates. Why are these things happening? Who are they happening to? Some proxies for poverty or lack of insurance. So 86% of our cohort had public or no insurance. The majority of these were in the assault and bystander group and in the unintentional shooting group. 39% of them lived in apartments, so that was about half the assault and bystander group, about a quarter of the unintentional group. The children that committed suicide were much less likely to live in apartments, much more likely to live in homes. 52% of them had single-parent households, and again, this was more common in the assault bystander group. this all kind of goes to this concept of structural violence, which you may have heard about, but it's a way of describing gun violence that goes to the root causes of economic inequalities, particularly in Houston and other large urban centers. It has to do with segregated housing and underinvested neighborhoods. And here are some more social correlates. So alcohol or drug use was about 29%. Reported history of interpersonal violence, about 30%. Criminal activity during the shooting, as far as we could find, was low, 16%, and gang affiliation was also low. But note that a lot of this data could not be found, and the place we got this from was from the hospital charts and a little bit from the death records. And so in order for us to really know what's going on, we really need to, as a trauma centers, make better efforts to collect and document this data, because it's really important for surveillance and for future planning. When we looked at risk factors regarding shooting location, and looked at home, whether the shootings happened at home, whether the guns were found from home or at a home of a family or friend, 90% of the suicides, not surprisingly, I guess, happened at home. 76% of them, of the unintentional ones, home or home of a family or a friend. And a lot of the bystander ones, poor kids are just sitting at home and got shot. It's really sad. 19% of the assaults. And then if you look at the cars, for the unintentional and the suicides ones, these were usually because of family guns that were left in the cars. Another 7% and another 3% of suicides. The assault bystander ones were most commonly in the street or parking lots, and we looked at public parks, and the incidence of this was low, which I guess is good in a way. So in summary of this slide, secure household firearm storage could have potentially prevented 93% of suicides and 83% of unintentional shootings, or overall 1 in 4 pediatric injuries or deaths. Digging a little bit deeper into suicide risk factors, known mental health or illness, most commonly depression, was found in 65%. Known suicidal ideation, where they had mentioned to a family or friend that they were thinking about suicide, was really low. And if you look at the family-related stressors, the events that occurred right before the shooting happened, it's about 30%, and these were arguments with parents fight or divorce, parents took away cell phones. I have a 13-year-old, so it's a little bit scary because this happens every single day, right? And then the other thing we found is that 20% of the teenagers were able to access firearms that were stored in safes that were locked. They knew how to get them. And drug use, most commonly marijuana, was about a third. Known alcohol use was low. This is data from Dr. Levine that I'm showing a little bit here just to give you a brief overview of where these shootings are occurring. And you can see that the intentional and the bystander shootings occur in similar areas, kind of inside of Beltway 8. And then the unintentional and this injuries happen in the urban and suburban areas of Harris County, whereas the suicides are happening in the suburban and rural areas of the county. So again, this all goes to kind of different risk factors for each shooting intent. So putting this all together, again, this is very preliminary, but this is a potential framework for suicide, for pediatric suicide in our county, and you can look at what we found so far regarding factors that go to individual relationship, community and societal factors. You can imagine how a lot of this can be used for injury planning efforts in the future. And then here's one for unintentional shootings that's a little bit different because there are different risk factors involved. So to summarize, firearm injury for people of all ages is on a rapid rise in Greater Houston, as it is nationally. Homicides are more prevalent than suicides in both adults and pediatrics. In children and adolescents, 20% of injuries are unintentional. Combined with suicides, safe or out-of-home firearm storage could have potentially prevented 1 in 4 pediatric injuries and deaths. Disparities in race or ethnic group, gender, and socioeconomic status exist regarding shooting intent. Social, individual, and neighborhood correlates can serve as risk factors that can guide injury prevention program planning. And finally, a plea: trauma centers should record more risk factors and shooting intent information for us to improve ongoing firearm injury surveillance. Thank you so much. I'd like to thank my research team, without whom none of this would have been possible. My collaborators, Dr. Pompey, Dr. Oliomi, Dr. Kane, Levine, who we'll hear from soon, and my collaborators at UT, at the Forensic Institute, and then our law enforcement, HPD, Harris County Sheriff's Office, Houston Fire Department. Thank you to the Texas Children's and Baylor Departments of Surgery for grant support, assistance, and Baylor iQuest, Baker Institute for their support and for hosting this wonderful conference today, and finally to the CDC for their support of our work. Next, I'd like to introduce my colleague, Dr. Levine. Ned Levine is an expert in geospatial analysis. He's an urban statistician. He's been doing this for many, many years. He's worked with crime data. He has also looked at the homicides in Harris County in much more detail than we're doing right now. He's been doing this for many, many years, and so it's an honor to have him here to share his wisdom with us today. Thank you.
Thank you. First of all, how do I flip this thing? Is this it here? No. Oh, this.
The big button.
The big button.
Yeah.
So how do I go back?
Probably this.
This goes back. Okay. All right. Okay. Good morning. I want to thank Dr. Nayak and Dr. El-Serag for inviting me to this, I think, very prestigious and very important conference. As Dr. Nayak said, I'm a sort of urban researcher, urban statistician, and consequently I tend to look at firearm violence from a data viewpoint. So I'm going to give you that perspective. Good. The first thing to realize is that firearm crime is a very rare event, and by rare it means only a small percentage of the population are involved in firearm violence, either as a perpetrator or as a victim. The vast majority of people do not experience this in any one time period. This means, I mean, if you think of it in terms of trying to understand it, it's not a behavior that's common, and consequently explaining it and modeling it is very difficult because we're talking about really small proportions of the population, and I mean very small proportions of the population. Now we have a long history of research on violence in America, well over 100 years worth of research, and if you want, the environmental or neighborhood correlates of violent crime are pretty well known. You know, dozens and dozens of studies have been done on this. I mean, we have poverty and all its associated characteristics associated with poverty. You know, broken families, alcoholism, drug use, high unemployment rates, dysfunctional children leaving school early, and getting into trouble and so forth. Lots of research have shown this. There's a lack of legal employment opportunities, and consequently illegal employment opportunities emerge in such communities. Discrimination, the refusal of banks to loan money to homeowners in those areas, the refusal of businesses to invest in those areas because of high crime, are well known. Lack of community amenities are there. Weak community organizations, and so on and so forth. We have tons of that research, as I said, 100 years worth. But these are not causes. These are correlates. Essentially, these are places where firearm events occur, even though the vast majority of people who live in those communities do not get involved in violent events. I mean, that's what we're talking about here. Consequently, in the last 20, maybe 30 years, there's been a shift to trying to analyze the triggers of violence, the individual characteristics associated with people who commit violence or, in turn, who are victimized by violence. And some things are known. several studies have shown physical and sexual abuse in childhood is associated with violence later in life. Alcohol and drug abuse is associated with it. Dr. Nayak's study is showing that. There's also, there are also prolific offenders. There are people who commit an enormous number of crimes, both property crimes and violent crimes. And these have been documented in a number of cities, and I suspect it's true here in Houston as well. And so actually a sizable proportion of all the crimes that are committed by really a handful of people. And so that's why I said trying to understand and trying to isolate these individuals is very difficult. Dr. Nayak's study is important because she's trying to link individual characteristics, at least as measured by the medical records, with the environmental correlates. And that's what we hope to do. There are also, and this is what I'm going to talk about for the rest of my time, is macro societal factors that affect violent behavior. And they're not really very well understood. People for a long time have been trying to explain them, but they're not easily understood. Let me try to show you why. First, let me jump here. In the United States, there are two measures at the national level of homicides. There's the FBI's data set, which comes from the Uniform Crime Report, but with much more information from what's known as the Supplementary Homicide Report. These are reports from law enforcement agencies. Over 18,000 law enforcement agencies in the United States send reports annually to the FBI, who compile them. The FBI pays them. It's on a voluntary basis, but since they get paid, they tend to do it. And they put out a crime rate, an annual crime rate. The second source is the National Vital Statistics System, which is managed by the National Center for Health Statistics, which is part of CDC. This is where these are reports from the medical examiner and coroner's offices, who then send it to the state, who compile it, who then send it to NCHS. Now, the two data sets, they have a lot in common. The Vital Statistics System is a mandatory, so all deaths are registered by definition, whereas the FBI system is voluntary. But they tend to track each other well. Typically, the NCHS system, the Vital Statistics System, gives about 5 or 10% more, let's say murders, homicides, than the FBI system, but they track each other well. So like here's a study that looked at the two over a 20-year period, 1981 to 2011. And you can see, the Vital Statistics System is slightly more, but the two tend to go in tandem. So let me go back, and where are we going? Oh, sorry, I'm going back. I got to go in the wrong way. Here we are. This is what I wanted to show you. I was able to obtain data from the FBI system going back to 1950. Okay, I haven't yet found one for the Vital Statistics, but we're looking for it. Okay. Now, what you see here is an interesting thing. If we start, I don't know what was happening after the late 40s, but let's say is there a cursor I can, does this thing work for that? I can push the button there. Oh, you do it on the screen. Oh, hold it, wait a minute, I'm going to go back here. So this points?
Yeah.
Okay. New technology. All right, I still can't see what I'm doing. All right, anyway, you can see it. All right, so, early 50s, it's sort of flat, the murder rate. This is the number of murders and non-negligent manslaughters. That's how the FBI defines it, per 100,000 persons in the U.S. It's flat. But starting sort of in the late 50s, there's an uptick, and it rises for, is this? Nah. And it rises for 20, 25 years. It just keeps going up and keeps going up, and it hits a kind of a peak in the late 70s. Okay. Then it sort of bounces around for another 15 years, going down, then it goes back up, and then it goes down again for 4 or 5 years, then it goes up again. And so if you can think of this, these are phases here. So we have an up phase, which raises the murder rate to a quite high level, something in the order of 10 per 100,000. And it sort of bounces around for about 15 years. And then there's a long down period that's going on, starting about I think 1993 is sort of the last year. Then it sort of drops precipitously. Now, researchers have tried to explain this, and nothing really explains it. Demographic factors can't explain it, economic factors, political, correctional policies. Further, if different people, different researchers, different time periods would interpret this differently. Somebody who's looking at it, say, in 1980 would say, wait, we've had this huge increase. Why is it going on? What can we do about it? You know, somebody looking at it in 1993 says, well, it's sort of stable. And then, and somebody looking at it in 2011, 2012, will say, wow, it's been going down. We've got control over this problem. But then look what happens. It starts going up again. The low point is 2013 in the latest, and now we're on an uptick. Okay, now is that a blip or is that a trend? I don't know, let me see the next one, go to the next one, we showed that. All right, so let me go back for a second. Go back, here we are. No, it's the same. I'm having trouble. I have data on Houston going back to 1995. So let's look at Houston here. What am I doing? I'm going the wrong way, sorry. Okay, excuse me for, there we are, Houston. Here we are. This is what was reported to the FBI. The FBI provides data on Houston up through 2018. For 2019, 20, and 21, we use the data that we got from HPD to do the count. But what you see is, there's a down for a while. Then there's a jump in the middle of the 2000, 2005, 6, 7, something like that. And then it starts dropping again. So it's more volatile than the national rates. The low point is hit 2011, then it starts up. Now, there's a jump in 2020, and so the COVID year probably had something to do with it. But this trend started well before COVID came along, okay? And what I fear is that it's going to continue well past the COVID period. The FBI also collects data, documents data on violent crime. Violent crime are things like assault, aggravated assault, rape, murder, of course. I think those are the three big ones. And they, again, provide data on Houston through, through 2018. And again, the last 3 years we calculated from the data HPD sent us. And you see this thing is going up. It's again, this trend started well before COVID, okay? Okay, here's the data we got from them so far. What do I have, 5 more minutes? 2 more minutes? 2 more minutes, okay, all right. So between 2018 and 2021, there were 41,358 incidents in the city of Houston involving a firearm. That's a 4-year period, so it's a little over 10,000 a year. Okay, here is the types of crimes involved. They're mostly aggravated assault and robberies. These include crimes where a firearm somebody was injured, somebody was shot, where a gun was discharged but no one was shot, where a gun was used but not discharged, such as a robbery, and this category called weapons law violations, which we still don't understand. But the two big ones are ag assault and robbery. And further, this is the increase we're seeing in the data over the 4 years. That yes, there was a big increase in 2020, but there was a big increase the year before, and there's a big increase the year after. All right, so here are the conclusions, and they're tentative. Much as I find it difficult to accept, I think firearm violence will probably continue to increase at least another 5 to 10 years from now. I hope I'm wrong. I really do hope I'm wrong, but I fear I'm not. There's too much momentum. You see these long waves here. This is going to have some implications. First, more resources are going to be needed to address this problem. That's going to affect law enforcement, it's going to affect EMS, it's going to affect medical treatment, community youth programs, after-school programs, gang intervention programs. And most of these programs are struggle to get resources at the best of times. Just imagine an increase in violence that is coming, what pressures it's going to place on them. And that's a problem. Secondly, in addition, elected officials are going to get some of the blowback. You know it's going to happen, you know, because people will start saying, why haven't you done anything about the firearm violence? And finally, the final point is, this is a more in the weeds type of methodological comment, but for people who run programs, they're going to need to try to evaluate those programs. They have to anticipate that there might be an increase just simply due to these systemic kind of societal forces that we don't really completely understand. And there are methods, there are Bayesian methods that try to correct for this, where you forecast the expected number if nothing changes, and then you can compare whatever you're doing to that expected number. But I think we have to live with this for a while. Anyway, thank you very much, and Lindy, yes, okay.